Hello, welcome to our Facebook Live. I am Sarah Aaron. I am the Director of Clinical Services with our KORT Outreach Program here in Kentucky. I'm going to be answering some questions today about the services that we offer in home. And I've got Lauren here with me, who's going to be asking me some questions that we get commonly from patients that we're hoping to answer today.
What will happen during my first in-home visit?
Great question. So in your first in-home visit, what you can expect is an evaluation by a physical therapist. What we would do is come in and talk to you a little bit. We like to get to know you first and find out your history, find out what your goals are. We're going to be talking about how to take care of yourself after surgery. Most of our patients are coming to us after surgery, so that's a big thing that we're going to be talking about, how to take care of your new joint or your spine or whatever that you're having surgery for. We're going to take a look at how well you move. We like to look at your walking, your strength, your range of motion, a few other things. And then we will be doing some exercises with you. We'll always assign out some homework to you for the first visit. And then a lot of times we'll be doing a little bit of manual therapy, stretching you out, kind of getting you moving a little bit if that's appropriate. And then we'll talk to you about what to expect on future visits.
How many visits will I need in-home, and how long do the sessions last?
That depends a little bit on what we're seeing you for. So, for example, if we see you after a surgery like a joint replacement or a spine surgery, we typically see you about 2 weeks at home. We've got really good research that shows the sooner we can get you ready to start in an outpatient clinic, the better your outcome will be, and that's our goal, is to get you moving as well as possible. So about 2 weeks is what you can expect there. Some people are improving quickly and ready to get there quicker. And some people may need another week, and that's fine with us too. If we're seeing you for a different condition, maybe you've been in the hospital with pneumonia or a fall and you've got a lot of weakness, sometimes it takes a little bit longer to build that back up before you're ready to go to the clinic. So that may be more about a 4-week program, but each visit typically lasts 45 minutes to an hour, sometimes a little bit longer on your first visit.
How much will this cost, and does my insurance cover it?
Well, insurance typically does cover it. We will accept you if we're in network. It just depends on your insurance plan. Sometimes if you have a copay in the outpatient clinic, you may also have a copay with us, which we don't actually collect any money from you in home. We usually allow you to call in and pay copays, or we send you a bill when we're finished. But yes, most insurances do cover us.
Do I need a nurse? Who will look at my incision?
If your doctor has referred you to KORT for your home services, in Kentucky you do not need nursing. Our physical therapists are well trained to help you take care of your incision, monitor for signs of infection, help you with swelling. We'll even educate you on your medications. We're going to be helping to monitor for things that a nurse might also monitor for, like signs and symptoms of an infection or a blood clot, and we are quick to notify your doctor if anything comes up that needs to be further assessed.
Do I need any special equipment in my home for physical therapy?
You don't necessarily need anything extra at home. We are very creative as home physical therapists, and we tend to utilize things like garbage bags, bathrobe belts, cookie sheets, things that you typically already have around your home to accommodate any exercises that we may do. If you are coming home from the hospital physical therapist will typically recommend you to come home on a walker or a cane, and the hospital will assign that out to you. If anything changes while you're under our care, which it will, so say you come home on a walker, after a week or so of being home, you're probably going to be ready to progress to a cane. And if you don't already have one, that's something that we can take care of for you. We can reach out to your doctor and see if they'll write a prescription to send to a DME company and help facilitate that for you.
How should I prepare my home for my visits, and where will we do exercises?
That's a great question. I think if you're going into surgery, the best way to prepare your home is by receiving a prehab visit, which is a visit to prepare you for surgery. We have some wonderful options to do that. Those can be done in clinic or in the home, but I think the preferred and the best option is to do that via a telerehab visit, we have a therapist that can talk to you through your device, your phone, your iPad, computer, whatever. And you can actually give her a little tour of your home. She likes to see how you get in and out of your car, what your front entryway looks like, how to get around your home. And she's really the best one to make recommendations for setting up your home optimally for surgery. If you're not able to do a prehab visit, hi Chelsea, we like to recommend that you are spending your time on the first floor. So if you can move your bed, if you have an upstairs bedroom, we really want you to try to move that situation downstairs. After surgery or getting home from the hospital, you are not going to feel like going up and down stairs all day. So we really like for you to be on the first floor. Exercises are typically done in the bed because that's just your biggest and your most firm surface. Let's see, if you have pets, it's preferred that the pets are put away. Sometimes little animals are very protective of their people after surgery, and they are not too keen on a therapist coming in and touching you, even though we're there to help, and most of us are animal lovers. Animals can just be a little bit protective, so it is best if they're put away. We do like for you to have someone else there with you, whether that's a spouse or a family member, just to help take notes and just kind of be a second set of ears. We understand that after surgery, most people are on pain medication, and so we just like for someone to be there that can help remember things. There's a lot of instruction, so definitely having someone else there with you is a plus. Let's see, we always recommend, clear pathways. Most of our homes are not set up to accommodate walkers if we're not already using a walker. So sometimes you come home and you think, oh my gosh, my doorways are so narrow, I never noticed because the walker doesn't fit through. Or you think, oh my goodness, my toilets are so low. They were never low before, but now that I've got a knee replacement, it's a lot more difficult to get up and down off of the toilet. Things like that to just kind of keep in mind. Of course, when we get there to evaluate you, we'll give you some tips and tricks on how to navigate your home. Let's see, other than setting stuff up. If you have a lot of stairs to get into your home, it's great to have a handrail. Ramps are okay too. A handrail is usually best because it's a little bit easier to navigate steps with a handrail than it is to get up and down a ramp with a walker. Did I answer your question? Is there anything else?
Where will we do the exercises?
We will do the exercises typically in the bedroom if that's available. The bed is just a better place to do the exercises as opposed to the couch. And we definitely don't want you getting on the floor. A lot of people suggest the floor, but we really don't want to try to get you up from the floor. So we'll do the bed.
What is your in-home safety protocol? Will your therapist wear masks and gloves while coming into my home?
Yes, absolutely. So our protocol, as encouraged by the Inspector General of Kentucky, is for us to come in with masks and gloves, and we will also have goggles for those times that we are in particular close contact with you. We also ask that our patients and any family members that are going to be in the room with us also to wear masks. That just helps to keep everyone safe, keep infection risks down. We want to do everything we can to keep our patients safe, and a big part of that is also making sure that we keep our therapists safe. We do have some safety protocols. We're sanitizing and wiping down all of our equipment in between our patients, and we're also doing a COVID screening before treatment to make sure that you haven't had any changes from treatment to treatment, no fevers, any of those cool COVID symptoms that we all know about by now.
What if I hurt too much to start therapy this soon?
I get that a lot. Doctors want us to come out and see you after surgery right away, and there's a lot of good research that says the sooner we get started, the better you're going to do. But we do understand that sometimes the first couple days at home are really rough. I actually call that phase the what did I get myself into phase. You have a lot more pain, a lot more swelling, a lot more difficulty getting around, and all that is very normal, and we fully realize that going in. So we will meet you wherever you are. Our job is to create a program that is individualized and specific to you. So if you're having a lot of pain, our protocol is going to be geared towards getting your pain down, getting your knee moving in a comfortable way to where you can tolerate it. And if that's even communicating with your doctor about modifying medications or things like that, then that's our goal too. If your goal is getting your pain down, that's our goal too. So we will definitely help with that. We don't want therapy to be put off because of pain, because that's really something that we can help with.
My doctor told me that I will need outpatient therapy after my knee replacement and after home therapy. How can I get that set up?
We will take care of all of that for you. We actually do some tests with you on the first day just to assess your mobility, and we use those tests to determine when you are ready and safe to start graduating from your home physical therapy and moving on to that next phase of outpatient physical therapy. So we will take care of setting that up for you, making sure that you get transitioned on time, and then coordinating care with your outpatient physical therapist too.
I have a friend who is having a knee replacement soon. I used you all in the past, and my friend would like to use you too. How can we get that scheduled?
We would love to see your friend. What a great question. All we need is your information. You know, we'd just like to know when you're having surgery, who's doing your surgery, what kind of surgery you're having. You're welcome to reach out to us. We'd like for you to call 1-800-645-KORT, and we will get everything taken care of and squared away. We do have several care options for physical therapy right now. You know, I oversee our home program. That's my favorite program. We'd love to see you at home if you're appropriate. We also offer telerehab for physical therapy, and then we also offer in-clinic care. Did you have any other questions for me?
That's all I have.
All right. Thank you all. Have a great day.